It is the appointed time and we have a quorum. Since the last meeting, the Secretariat hasn't issued any information paper. Items of discussion at the next meeting, please refer to LC paper number CB bracket 1 1422/2025 bracket 01 and bracket 02. The next regular meeting will be held at 10:45 a.m. on the 13th of October 2025. It's a Monday. The administration proposes discussing the following items. A. Implementation progress of the residential care services scheme in Guangdong, and B. Implementation progress of the pilot scheme for elderly CSSA recipients to reside in residential care homes in Guangdong. The administration suggests that we have a combined discussion on the two items. Do members have any comments? If not, we have with us the Labor and Welfare Bureau as well as the Home and Youth Affairs Bureau. They will give us a briefing on this year's policy address. Please refer to LC paper number CB bracket 1 1422/025 bracket 03 and bracket 04. I will invite Mr. Chris Sun, Secretary for Labor and Welfare, to walk us through paper number bracket 03, and Mr. Clement Leung, Undersecretary for Home and Youth Affairs, to walk us through paper CB bracket 04. Mr. Chris Sun, please. I'll spend a few minutes on the major initiatives under this year's policy address. First, on targeted poverty alleviation. I'd like to bring up 3 points. It is expected that we will have 6 more community living rooms, including the existing 9 community living rooms. There will be at least 10 community living rooms. Also, we are coming up with a few ideas. First, under the Poverty Commission, we will roll out a caring society subsidy scheme. We will provide services and subsidies on a matching basis to link up private charity funds with community organizations. We will build a platform to match up the two. Also, for families receiving CSSAs, if they have the ability to leave the CSSA scheme, we will enhance the incentives for them to do so. Of course, we will also devote resources to continue to care for our elderly. We will have 4,000 more community care service vouchers for the elderly. We will have 1,000 more residential care services vouchers. We will also put in more resources for residential care services in general. Under the residential care schemes for Guangdong, we will have the total number of participating RCHEs from 15 to 24. And 8 out of the 9 GBA cities will be covered under this scheme to provide more options for our elderly. I'd like to mention that for the RCS scheme in Guangdong, it only covers RCHEs in Guangdong, but for those who are currently living, for example, in Beijing or Shanghai, they can also participate in the RCS scheme in Guangdong to provide convenience to them. However, at the moment, we would like to focus on RCHEs in the GBA first, because we want to perfect the services in the GBA. Over the past 2 to 3 years, we rolled out services such as the Hotline for Carer Support 182, 183. We also rolled out the Information Gateway for Carers. We will continue to improve services to support carers. And all these initiatives are set out in the policy address. The government is showing its determination. The CE mentioned that we are reserving $500 million for supporting carers. Some of the schemes are not planned yet. The $500 million is for when it is needed, we can provide resources for carers. Also, we'll have support for persons with disabilities, and for childcare services, there will be 15 new aided standalone childcare centers providing a total of 1,500 day childcare service places for children aged between 0 and 3. We will focus our resources on infants and toddlers aged between 0 and 2. This is because we see that there is more demand for services for infants and toddlers. So service places will be allocated to infants and toddlers, and there will be a significant increase in terms of the services to be provided for them. Now, the mandatory reporting of child abuse ordinance will take effect starting from January next year. We have launched a large number of publicity campaigns. We are confident that by the time the ordinance takes effect, all the support measures will be ready so that the entire community can go further in protecting our children. Now, on promoting mental health, it involves 3 bureaus: the Health Bureau, the LWB, as well as the Education Bureau. At the community level, the LWB will be in charge mainly. The next item is about mental health for today's meeting, so I'm not going to go into the details here. That's all for my briefing. Now I'll invite Undersecretary Mr. Clarence Leung to speak. Good morning, everyone. I will speak briefly on the policy initiatives in respect of social enterprises and the community care fund. To continue to promote the development of our community, we have more options and diversified development for social enterprises. The public has more knowledge about SEs nowadays. We will continue to promote about SEs to encourage the public to support SEs. We will subsidize organizations to provide training for SEs to enhance their capacity. We will continue to launch the Enhancing Self-Reliance through District Partnership Program to help the socially disadvantaged. Since 2006, we have subsidized over 270 SDs projects, which have directly employed over 8,000 people. In 2025-26, we will consolidate the resources we have and roll out the Social Enterprise Subsidy Scheme. This scheme will offer support to promote cross-sectoral activities. On the Community Care Fund, the LWB chairs the Community Care Task Force, and the SWD serves as the Secretariat. We look at suggestions on rolling out new assistance programs. Any new programs will have to be examined by the Poverty Commission as well as the Community Care Fund Task Force. Since its establishment in 2011, the Community Care Fund has rolled out 76 assistance programs, benefiting 3.5 million cases. And some of the programs have been incorporated into the regular assistance programs. The fund will continue to review the existing programs to see how we can review the programs to better meet the needs of our target beneficiaries. That's all for my briefing, and I welcome any questions or comments from members. Thank you. 11 members have asked to speak. I'll read out their names and I will read out the lineup. Mr. Chen Pui Leung, Dr. Teck Chi Yun, Mr. Kenneth Leung, Ms. Connie Lam, Mr. Charles Shu Chung, Mr. Ambrose Lam, Ms. Doreen Kong, Deputy Chair, Mr. Andrew Lam, Ms. Lillian Kwok, and Mr. Benson Look. 5 minutes each, including questions and answers. Mr. Chen Pui Leung. Thank you. I'd like to ask about the policy initiatives of the LWB. Paragraph 15 of the paper mentions that the residential care scheme in the GBA will be enhanced, and a 3-year scheme will be rolled out to subsidize elderly people who stay in RCHEs in Guangdong. There are only 1,000 quotas, but 111,000 elderly people are receiving CSSA. That's about 1%, I mean the quotas. I understand that we have limited resources. However, is there room to further increase the number of quotas under the scheme? If we have lots of applicants, how will the government decide which applicants will get the quota first? That's my first question. Second, on stepping up childcare services. In the coming 3 years, between 2026 and 2027, there will be 15 new aided standalone childcare centers providing 1,500 day childcare service places for children aged between 0 and 3. That's double the current capacity. As mentioned by the Secretary just now, resources will be focused on infants and toddlers aged between 0 and 2. I think this is in line with the needs and demands of families with newborns. However, there are in total just about 1,000 quotas. In future, if resources are focused on toddlers between age 0 and 2, how will resources be distributed? Will there be insufficient demand to satisfy the needs of families with older children? Secretary, I thank Mr. Chen Pui-leung for the questions. We will roll out a pilot scheme for those elderly people receiving CSSA to have an additional option. They can choose to stay in the 24 designated RCHEs in the Guangdong scheme. When they get to the mainland, they can get about $4,500 of subsidies. We are increasing the subsidy to $5,000. That means there will be more options for them in terms of RCHEs. As you know, if you stay in RCHEs, you have to pay the deposit first and other fees. So $5,000 should be enough for them. A lot of elderly people are currently receiving CSSAs, but so will the 1,000 quotas enough for CSSA recipients? Well, we made an estimate for elderly people who are currently living in public rental housing. They have less incentive to stay in RCHEs in the mainland. We believe that it will be mostly the elderly people who are living in private RCHEs or those who are living in inadequate housing currently to apply for this scheme. So we don't think it's 1% of the total number of CSSA recipients we are looking at. We will mostly have 5,000 to 6,000 applicants for this scheme. As for the standalone childcare centers, most service users are those aged between 0 and 2. We were seeing a huge demand for this group. For those aged above 3, the usage rate is relatively low. And for this reason, since there will be new aided standalone childcare centers, and that there will be room to further expand the services, we think that we should use the resources to satisfy the needs of toddlers who see the greatest needs for this service. If we focus the resources on this age group, it will greatly satisfy the demand. For those aged about 3, we see that the supply of services for them is quite good. And it is exactly for this reason that we are adopting a sign-based approach, and we decided to allocate resources mostly to toddlers aged between 0 and 2. Perhaps I can supplement. I thank Mr. Chen Pui-leung for asking about the pilot scheme for elderly recipients of CSSA to reside in RCHEs in Guangdong. This is an additional option for elderly people. An elderly in Hong Kong who can pass the standardized assessment, he can get full subsidy to stay in RCHEs in Hong Kong or in the Greater Bay Area. So this is a special scheme dedicated to elderly recipients of CSSA. These elderly people are old and they failed to pass the standardized care needs assessment mechanism for elderly services because of various reasons. If they choose to stay in Hong Kong, they can use their CSSA to live in RCHEs. Now we are offering an additional option for them to stay in the Greater Bay Area. There aren't that many elderly people who fall under this situation. That is, elderly people who fail to pass the standardized care need assessment mechanism in Hong Kong, and those who are receiving CSSAs and would like to stay in an RCHU in Guangdong. Like the Secretary said, the amount of CSSA they are going to receive will be increased to $5,000. And with this monthly subsidy, these elderly people should be able to choose to reside in one of the designated RCHEs in Guangdong under the scheme. For elderly people who are currently living in public housing, they might not need to move to an RCHE in GBA. For those who are receiving CSSA, they may not be living in a very adequate environment. So this scheme will provide an additional option for them. Those who are living in inadequate private housing, this again can be an extra option. So for frail elderly people, they should be able to pass the standardized care need assessment. So those who are eligible for this scheme, we believe there are about 5,000 to 6,000. Say 10 to 20% of these 5,000 to 6,000 people are applying for this scheme. We think that 1,000 quotas as a starting point is adequate.
Next member, Dr. Chi Yun. Thank you, Chairman. In the policy address, the Chief Executive talked about a working group on aging society's strategies. I agree with that. We have an aging population. 1 in 4 people in society is an elderly person. That's why I think it is indeed a good idea to have this working group. It should be a high-level one. It should also be an interdepartmental one. Ideally, there should be an annual report. In addition to colleagues in the administration, I hope members will also include scholars and representatives from elderly associations. We need to combine forces of the government and of the community. We need a medium to long-term plan that is more ideal. In the upcoming budget, I may propose a fund targeting an aging population in Hong Kong. The fund size is about $5 billion. An aging population isn't necessarily a risk. The elderly in society are actually quite energetic. Some elderly people need to be taken care of. If we have a fund, and if we have a working group, we can walk the talk. This is my proposal for the Secretary's reference. Well, as I understand, the Working Group on Aging Society Strategies focuses on medium to long-term strategies. However, there are high-risk families in society, and they require our immediate help. In recent years, there have been unfortunate events, as we can see in news. The Secretary should set up a task group as soon as possible covering the Health Bureau, the Home Affairs Department, and so on. We need to formulate a list of high-risk families in Doubleton elderly families. We need to provide immediate assistance regarding supporting measures. there is a regularized fund of $500 million. This is good. We need to enhance support services. We shouldn't wait anymore. As for the list, it was mentioned in the policy address last year, but I haven't yet seen any effective and pragmatic policies. Now that we have a list, we have a working group, we need to provide immediate support services. I hope the Secretary will make this happen as soon as possible. Secretary, thank you. I will forward your proposals to the Deputy Chief Secretary for Administration. He is the head of the Working Group on Aging Society Strategies, and I'm the deputy head of the working group. Singleton and Doubleton elderly families, as well as other families in need, are causes of our concern. Starting from July this year, we have already been working on providing assistance to them. There is an interdepartmental working group providing help to them, covering the Health Bureau, Hospital Authority, Housing Department, and care teams. We have been working very closely. We already have a list. We have all the data required, and we are channeling resources into helping them. Say the Housing Department has already passed the list of Singleton and Doubleton elderly families to us. We have already mobilized all care teams across Hong Kong to provide assistance, not just the care teams in Kwun Tong and in Sha Tin. We have mobilized all the care teams in Hong Kong. But of course, we cannot visit all families in Hong Kong. There are tens of thousands of them in Hong Kong. If we can visit 5,000 families, that's actually already a very good progress. We have identified 400 families that require assistance. We have targeted 10,000 families which are receiving carer allowances. Upon learning the fact that these carers have been hospitalized, we will be informed immediately. Then we will render assistance right away. We will try to enhance our speed, efficiency, and so on. Thank you. Next member, Mr. Kenneth Leung. Thank you. This year's policy address talked about a package of measures about boosting the fertility rate in Hong Kong. This is worth our recognition and support. In paragraph 16 of the paper, new aided standalone childcare centers are covered. They provide a total of about 1,500 day child care service places. They target children aged 0 to 3 years old. This is indeed a very good policy. I hope the Secretary will focus resources on helping this category of children. And I'd like to ask the Secretary about geographical distribution. For Sai Kung and Wong Tai Sin, are there any subsidized standalone childcare centers? Will you accord priority? There are a lot of young families in these districts. Will you accord priority to providing standalone childcare centers in these areas? On different occasions, we already discussed this. We cannot just rely on the government to provide childcare facilities targeting children aged 0 and 3 years old. Will the government encourage public organizations to provide more childcare services? I'd like to know the progress. Can you give us any update? Next, I'd like to ask about the school-based after-school care service scheme. The quota in the past will be removed, and I'd like to follow up. In the previous year, the scheme was extended to a total of 110 schools. It was quite good progress. I'd like to know the manpower distribution of staff members of NGO. Can the manpower cope? From the perspective of targeted poverty alleviation, We want more parents to join the workforce of Hong Kong because of the scheme. However, the supplement mentioned KPI, but it is silent in this regard. I'd like to know whether there are any such figures to be provided by the Secretary. Thank you. Thank you, Mr. Leung. He just now referred to the 1580 standalone childcare centers. They are spread across the territory. In some districts, we do want to provide such childcare centers, but sometimes we have to wait. But in areas where we can provide services, of course, we will build or construct such a standalone childcare centers. For detailed information, we will provided after the meeting to Mr. Kenneth Leung. For enterprises which want to provide standalone childcare services, we welcome them. For the largest bank in Hong Kong, they have their own childcare centers as well. There is a public organization in Hong Kong that wants to provide a standalone childcare center, and we support it. We are willing to provide assistance. Regarding the school-based after-school care service scheme, there is no quota at present. There are a lot of NGOs in Hong Kong. As long as schools want to provide services, there are matching services. We will match these schools with an NGO. Regarding KPI, we want to release parents so that they can rejoin the labor force when they can join the scheme and the children are taken care of by somebody else. Thank you, member, for your proposal. Next to Ms. Connie Lam. Thank you, Chairman. I'd like to follow up on social welfare policies. I thank the policy address. The CE mentioned in the policy address $500 million are devoted to providing for carers. Starting from July, there were 2 pilot schemes covering care teams in Hong Kong to provide services for carers and those who are cared for. I'd like to ask about services for high-risk families and carers. The policy address talked about expanding the one-stop information gateway for carers. There will be better connection between the government and other public organizations when it comes to information, but this involves a lot of different departments within the government and other public organizations. A lot of sensitive data are involved. This is close to the heart of the public. I'd like to know whether the government has any new policies to handle privacy concerns. Are there any new technologies involved? The SWD, the Hospital Authority, and the Housing Authority, they work together to facilitate the flow of information. So how can you make sure the information will not face any leakage issues on the platform? How can you guard against any abuse of information? Next, regarding high-risk households, 300 households will install intelligent accident detection systems. Are there any pilot areas? How are you going to implement this policy? Say, are there any sensors to detect whether elderly people leave their homes? Will the information be sent to the housing department, or will it be sent to another department? Are there any cameras, bed sensors, sensors about movements? Thank you, Secretary.
We all care about the carer support data platform because we want to make use of big data to help high-risk family households with elderly people as well as persons with disability. We have to comply with the PDPO. the Personal Data Privacy Ordinance. We have to be clear with the legal principle so that we can totally comply with the ordinance. Everything that we're doing now complies with the ordinance because we are in close liaison with the Personal Data Privacy Commissioner. Also, on the sharing of data, there are lots of available technologies. As long as the technologies is applicable, we will make use of it. Also, we are treading very carefully as we work with the hospital authority. We want to start with a small scope of data first. After we see that the sharing of data has become mature, then we will expand the scope of the sharing of data. Also, it's not that the data can be accessed by anyone. Say, for example, the housing authority has given us the data about singleton or doubleton elderly. Our district care teams do not have access to these data. They just know that they need to pay visits to certain households. The district care teams are there to visit the elderly people. And when they realize that there is a need for certain households to be referred to other services, they would pass the case to the relevant social welfare organizations. This is how we are making good use of existing resources for us to identify the elderly people or people in need in a precise manner. So please rest assured that everything that we do complies with the PDPO and that we will make good use of the data platform to identify high-risk elderly people. So what will be the biggest challenge? The biggest challenge lies in supporting the elderly people in need. After we've identified them, we will need the concerted efforts of all sectors in the community. Also, as mentioned in the policy address, we will identify 320 family households with elderly people to test out the gerontech products and technology. As to which 320 households they should be, for example, how many of them should be living in private housing, how many should be living in public housing, we're still ironing out the details. We're also testing out the different types of gerontech products. Perhaps not all 320 households will use the same types of products. Perhaps some of them will try using wearable devices. Others may make use of products involving radar technology. We will talk to our colleagues, and if you notice any good products, please let us know. So we will first select 320 households to test out the products. Next, Mr. Chao Shu-chung. The Chief Executive in this policy address has put forward a number of initiatives to help with those in poverty as well as to those in need. In terms of care for or support for carers, I appreciate that there will be a recurrent expenditure of $500 million to support carers. I hope that the initiatives will be taken forward in the long run. Now, my first question. It is mentioned in the policy address that there will be a professional diploma subsidy scheme for health and care practitioners. Will the participants get a full subsidy to enroll in the program? Also, will there be a cap on the number of participants in this scheme? In 2019, there was a training subsidy scheme for RCHE staff. So I want to know if this scheme is more or less the same as that previous scheme. Also, will there be subsidies for RCHEs who would like to pursue further studies to encourage more health and care practitioners to enroll in professional courses. Also, I'm happy to see that the government will introduce 15 new aided standalone childcare centers in the coming 3 years. I'm very concerned about childcare services, as I have mentioned a number of times on different occasions. Will the 15 childcare centers mostly be situated in new development areas, for example, in the northern metropolis? As I have mentioned a number of times, in Wong Tai Sin, there is a huge demand for childcare services. It's hard for people to get even one service place. So, with the new childcare centers, I want to know if you are going to select the appropriate locations to situate these childcare centers. For example, there was a scheme for the government to buy private premises to provide social welfare services. So in the short run, will you locate the childcare centers in districts with the highest demand? Secretary. Well, let me first talk about the professional diploma scheme for health and care practitioners. I believe we share the same views. We hope that there could be more opportunities for health and care practitioners to move up the career ladder. For local workers, if they're working as care workers, we want them to become health and care practitioners. And for those who are currently serving as health and care practitioners, we want them to be promoted. There's currently one rank that they can move up to. So you can say that this is a promotion letter for health and care practitioners. If they manage to move up one rank, they will be actually regarded as registered nurses. So this is an important letter for health and care practitioners. We hope to provide as many opportunities as possible for healthcare practitioners to develop their career and move up the ladder. As for childcare centers, there will be old and new childcare centers. We'll provide supplementary information after the meeting. As for the $5 billion scheme, as mentioned, we want to provide more social welfare services. If we manage to identify the appropriate premises, we want to convert them into child care centers. There is a high demand for child care centers. For example, the height cannot exceed 12 meters for child care centers. And so it's hard for us to identify the right premises because we have to take into account the surrounding facilities and the surrounding environment as well. I'll now defer to my colleague to talk about the diploma program. For the diploma program, there are two parts. First, there will be subsidy for the tuition fee. And second, we are offering subsidy to the RCHEs concerned. This is because if a health and care practitioner is going to enroll in the program, the RCHE concerned may have to hire a new staff. So depending on the manpower resources available, we will decide how many places we can offer it under the diploma program. We hope that by the middle of next year, we'll be able to launch this program. Secretary, is this program free? Our idea is that the program will charge a tuition fee. We will roll out subsidies, and hopefully the subsidy will be enough to cover the tuition fee for the diploma program. Next, Mr. Ambrose Lam. I'm looking at paragraph 17 of the paper. The heading here is Strengthen Family Cohesion and Safeguard Children. I'm upset with the heading. The government always encourages childbirth, but we see a high divorce rate nowadays. So that means half of the families are divorced, and children born in a divorced family, they face huge mental problem. In the UK and Australia, there is a system that emphasizes the co-responsibility of parents. Our judges in Hong Kong have been calling for the same joint responsibilities of parents. Our panel supports this idea, and we haven't got a submission from any community organizations that objects to this idea. But we've been talking about this for 20 years, and we still haven't seen the legislation enacted for this. And in 2018, the government organized social welfare centers to support divorced families, but it didn't work. We don't have laws to deal with the responsibilities of divorced parents, and the education we have been offering to parents isn't working either. So we have to first educate parents before we ask them to give birth to children. This legislative session is coming to an end soon. I want to know if the government will launch the legislative exercise to provide for the joint responsibilities of parents. Also, I've got comments that the district care teams have done a great job during the number 10 typhoon. So I'd like to take this opportunity to thank the government for its work. Secretary, we have discussed this a number of times. Mr. Ambrose Lam has told us about the views of the legal sector, as well as the views on the children proceedings parental responsibility. We will try drafting a bill, but as we know, there are divergent views in the community. For divorced parents, they are facing many disputes in terms of maintenance fee. Starting from next year, we will, through the 5 working parent centers, offer support for organizations or groups with strong views on this. We will see if there is going to be a change in attitude. At the community level, if we manage to forge a consensus, it will provide a better and a more robust basis for the government. It's not actually that hard to draft a bill. We have already drafted one. What matters is that we need to have a consensus in the community. We don't have to align with each other exactly, but we need to at least have a proposal that's acceptable and agreeable to most people. So we have to first focus on education so that there won't be too many controversies before we commence the legislative exercise. As to when we can enact a legislation on this, I cannot say for sure. We hope that we can work on what we have now, and once we have a platform and when those who care about this agree that we have the conditions to launch the bill, then we will move towards this direction. Chairman, I'd like to add one point. The government always says that there are opposing views. Well, can you please direct the opposing views to me so that I can learn about why they're opposed to this? So far, I haven't heard any opposing views. So I completely do not understand why the government is still not enacting the legislation. Secretary, do you have anything to add? I understand we will continue to work with the legal sector. If there is concern, we can talk to the 5 working parent centers. We can also talk to the Law Society. So please do not misunderstand. We're not trying to stall things out. We don't have this intention. As you can tell from the current term government, that if there's a need to make reform, we are very willing to do so. But when it comes to enacting legislation, if there are strong views, strong opposing views from community groups. We cannot simply ignore them. We're talking about women, the socially disadvantaged. We do not want unnecessary disputes in the community. We have to make sure that things can be taken forward in a steady manner. We have to first get things right in our education and provide the information to parents. If we are sure that this can benefit both parents and children, then of course we will move towards this direction. However, if the preparatory work is not done and we just roll out this bill, there will simply be disputes and arguments. So we want to be prepared first. We want people to have a better understanding of this. That's why we're focusing on education. And if we have the favorable conditions, we are willing to enact legislation.
Well, I have already said what I had to say. I have nothing else to add. Thank you, Ms. Doreen Kong. Thank you, Chairman. The current term government has made some breakthroughs in relation to social welfare policies. Some concrete policies have been proposed and implemented in relation to after-school care, mandatory reporting of child abuse. We have seen significant progress. In the policy address, different measures are mentioned. They aren't new ones, but they are enhanced versions. There are also policies receiving more grants, and I'm glad to see this. I have a few questions to ask the Secretary. I'd like to ask about the after-school care services in relation to the enhancement of the school-based after-school care service scheme. The quota has been removed. This is good, but I'd like to know how the government will allocate the additional resources, say teachers and venues, in order to ensure the quality of services. We need to prevent the deterioration of quality of the scheme. We need to make sure the quality will stay the same, especially for single-parent families or low-income families. And I'd like to ask about aging in place as well. The government has been doing a lot on this front, whether through the Labor and Welfare Bureau or care teams. Usually we focus on elderly people living in public housing estates, but we have to recognize the fact that there are a lot of singleton elderlies living in society. They aren't very rich, but they aren't living in public housing estates either. When they live alone, they are actually feeling very lonely. They aren't on the radar of care teams. After all, resources are limited. I'd like to ask the Secretary, these elderly people won't take on domestic helpers to take care of them. In the face of the surging population of elderly people in Hong Kong, we cannot overlook this situation. Will the government do more to take care of singleton elderly people in Hong Kong? In some other places, there are call hotlines to provide services for elderly people. Say there are people to chat with them. Will we draw reference from other social welfare organizations to help these elderly people in society? Say we need to leverage the help of the Samaritan Befrienders Hong Kong on the training of care. On the training of care teams, different skills are involved. Say nursing skills, psychological or mental pressure skills, and so on. Will care teams be upskilled? They need to enhance their capabilities in order to provide more appropriate assistance to those being cared about. Secretary, thank you for your questions, Mr. Nkong. Well, rest assured, the resources will be channeled appropriately to school-based after-school care service scheme. Actually, Teachers of the school don't have to take part in the scheme. The manpower will be provided by NGOs and the resources are provided by the Community Care Fund, CCF. As long as schools are willing to take part in the scheme, we accept their applications and we will provide assistance. We also provide matching services to match schools with NGOs. When there's a higher demand, the quality won't suffer. We provide matching services and we ensure the quality. Aging in place is the highlight of the elderly care policy. Singleton elderlies are indeed an issue. For Northern Europe, where it is much colder, there is a greater sense of loneliness. When we visit the community, some elderly people aren't very poor, but they feel very lonely. There are over 200, actually hundreds of elderly care centers scattered throughout Hong Kong. There are neighborhood care centers. There are also elderly care centers all across the city. We ask these elderly people to come to our centers. They can sign up for activities in Hong Kong, in these centers as well. Even if they aren't going to join the activities, Geron technologies in Hong Kong are actually quite good. I visited elderly people with the chief executive. As long as they press a button, they can already chat with nurses. We don't necessarily need the help of the Samaritan Befrienders Hong Kong. They work on suicide prevention. Elderly people may not want to give them a call. Say for the EAS emergency alarm system, it is not the case that they require assistance immediately, but they simply want to chat with the operator of the hotline. We want to make full use of our resources. We don't necessarily need to use a phone. Elderly people may play games on iPad. They can video call their family members. So we will exhaust all means to help elderly people. The opposite of feeling loneliness is connections with society. We want to connect elderly people with society. All right. Undersecretary of the HYAB, thank you. Care teams have been set up for 2 years. A lot of work has been done. We have received quite a lot of feedback from the community. The feedback is positive. We thank Mr. Ambrose Lam as well. A typhoon hit Hong Kong last week. The 3 committees, care teams, and the district council all came together to help. Under the leadership of the chief executive, we plan ahead under the leadership of the chief secretary for administration as well. Volunteers of care teams work very hard to help the community to pick up the pieces of the typhoon. We are grateful to all our colleagues and the volunteers of care teams in Hong Kong. Based on the question of Ms. Doreen Kong, in the past 2 years, as of late June this year, data show that care teams visited a total of 500,000 of families in need, covering elderly people, carers, and so on. The situation in each district varies. Community care teams are well up in the situation of different districts. That's exactly why they find it easier to build trust with these families, and they also find it easier to get in touch with them. Just now, as Mr. Chris Sun said, care teams work with the SWD. SWD provides appropriate training for care team members. Volunteers then can identify families in need and those who require assistance. However, volunteers from care teams cannot replace professional social welfare departments. When care team volunteers identify needs or identify families or cases that require professional help, we refer these cases to the SWD. We work closely with the Labor and Welfare Bureau and the SWD. Thank you. Next member, Mr. Andrew Lam. We are facing an aging population and a demographic structural change. We need to take the perspective of a macro level. Otherwise, it is difficult to solve the long-standing problem that we are facing. However, it is not a good time to discuss population policy today. But against the current backdrop, I have to applaud the Labor and Welfare Bureau. You have acknowledged these issues and you have been trying hard to solve them. In this year's policy address, it proposed the setup of the Working Group on Aging Society Strategies as well as the Information Gateway for Carers. The integration of these two is very important. We need to focus on aging in place. Now we have the principle of aging in place as a core with institutional care as backup. I'd like to raise some concerns. I hope the Secretary and other departments will continue to work hard. First of all, on aging in place, the Housing Department and the Housing Authority should render assistance based on the data platform. Some elderly people do have assets, but this doesn't mean they aren't feeling lonely. I know care teams are working very hard. For property management companies, they need to refer to their KPIs. Care teams may face a lot of different issues. In this regard, I don't have any panacea to propose. But I'd like to know how we can make better use of the data to improve our work. When it comes to private buildings, we need to enhance our data about elderly people. Next, the Secretary mentioned the situation in society. That is, the elderly taking care of the disabled and the disabled taking care of the elderly. These situations are becoming more common. In a lot of situations, some disabled persons may be carers, but actually they need to be taken care of as well. There are quite a lot of issues when it comes to mobility about these people. Sometimes we need to implement changes about hardware whenever it is possible, but it may not be the most effective. Regarding the application and extension of technologies, the Bureau needs to work harder. You need to rack your brains to render more assistance to PWDs. If we can help them, they can help themselves or they can help people around them as well. Then this will ease our pressure on the financial burden of social welfare expenditure. Thank you, Secretary. Thank you, Mr. Andrew Lam. Mr. Lam has made a very good point. The government does keep a close watch on the challenges brought about by an aging population. If our demographic structure doesn't change, the aging population will only peak in 2046. In an aging population, the number of elderly people will rise. 1 in 4 people is aged 65 or above. 10 years later, the figure will rise to 36%. That is 3 out of 4 people will be aged 65. At present, 400,000 people are aged 80 or above. In 2046, the figure will rise to 1.2 million or so. That is about 16% of the entire population in Hong Kong. In other words, 1 out of 6 people will be aged 80 or above. Well, in the future, the elderly will be more educated. They will also be enjoying high income. We need to prepare for the demographic change, but we need to take baby steps when it comes to implementing changes. Demographic changes happen every year. Aging in place is at the top of our agenda. Private housing is different from public housing. We have data about public housing estates. When it comes to private housing, 3 out of 4 elderly people are recipients of different cash allowances of the SWD. We have already got a lot of data. We may come up with different proposals. We may not know exactly where they live, but we have data. Say some elderly people are concentrated in particular areas, then we need to implement more policies. But undeniably, when it comes to private buildings, we need to work with property management companies. We need to make good use of technologies to have more data about these elderly people. Technologies don't just help us to find elderly people, they can also help us to find PWDs. We need to use more technologies developed by our country as well. They're good, they're cheaper, and they're very effective as well. Thank you.
Ms. Lillian Kwok. Thank you, Chairman. First of all, I see that the current term government has done a lot of work in social welfare and a lot of breakthroughs have been made. But I'm sorry, Secretary, we still want more improvement in the initiatives to be rolled out. So I have the following questions. I finally see an initiative that offers bridging support. I remember back in 2022, there were cases in which there was a lack of bridging support and it resulted in tragedies. I see that in the northern metropolis, the government is determined to support those who have left residential care services. I think these are great initiatives. I want to know how will the government take forward the initiatives. Have you thought about collaborating with schools and communicating with them to offer support? Apart from offering support to those who've left residential care services, for those whose parents have suddenly left or died with no one offering care to them, will you offer support to these children? Now, for those who are moving from kindergarten to primary school, I think bridging support is crucial for students with special education needs, especially at the kindergarten stage. We want to identify those in need early. We see that there are needs from autistic students. The golden time to offer support to them is when they have yet to reach 6 years old. We offer a lot of support to these children in the classrooms. However, we still need, for example, shadow teachers to offer help to these children. Parents have been talking about this. Many parents are paying out of their own pockets to hire shadow teachers to offer support to their children. However, when these children get to primary schools, there's no longer the support from shadow teachers because of various reasons. So how can we consolidate and rationalize all these support measures so that we can offer help to students, especially the autistic ones, before they reach the age of 6? At least half of them need the support, And I did not come up with this on my own. A lot of studies show that these children need support. Now I'd like to turn to the after-school care support scheme. At the antechamber meetings, many members proposed to the government that we should remove the cap on the number of beneficiaries, and I appreciate that the government has taken on board our comments. However, under the scheme, we need NGOs, and once you've approved the application, you'll include the NGOs in the list. I understand that you need the support of NGOs, but how come you cannot trust school principals more? Say, for example, a school may have engaged an NGO, but because the NGO is not on the list, they cannot engage that particular NGO. So can you offer greater flexibility? Some NGOs may not have the experience in offering after-school care. However, they have experiences in offering support to children. So can you relax the restrictions in this regard? Now I'd like to turn to the Parent-Child Center. Well, please leave time for the administration to reply. Well, I'll be quick. This is just a comment. There will be 23 parent-relative centers and 3 parent-child centers and 4 parent-child centers. Well, you have been offering rehabilitation service in Tin Shui Wai. There are a couple of integrated centers there, so will you consolidate and rationalize the resources so that we have more comprehensive support for those in need? Secretary, please give a brief reply. We share more or less the same views. We've taken on board many members' views as we came up with the policy. I'm glad that we have the recognition from Ms. Lillian Kwok. In the interest of time, perhaps I'll ask the Undersecretary to say a few words. Or the Deputy Director. Thank you. On the after-school care services, schools can actually reach out to NGOs on their own. There is flexibility. Say, for example, if school principals want to work with certain organizations, we welcome that. If they encounter any difficulties, we are willing to offer assistance to them. On Parent-Child Center, as we know, there will be 4 new Parent-Child Centers in 2026 to offer help to high-risk family households with children. These centers play different functions. After these centers are set up, we will see if there are any existing partnership schemes or if there is room for us to transform these centers. Next, Mr. Benson Luke. Thank you. I always care about the Strive and Rise program for targeted poverty alleviation. I was once a participant of this program, and I think this shows that the government tries to address the problem of poverty, especially to help our young people to move up the social ladder. On addressing intergenerational poverty, I think the Strive and Rise program represents a breakthrough of the current term government in terms of its mindset. Now I'd like to turn to the financial position of the government. As far as I understand that about $10 million were raised by the government earlier this year. And according to the government, we have about $138 million left for the Strive and Rise program, so we have enough balance. Will you consider regularizing this program so that it can continue to run in the future? Now, on the policy objective of the Strive and Rise program, the original objective is to organize activities and ultimately reduce intergenerational poverty. And this program starts from young people. Statistics show that young people benefit from obtaining financial management skills through this program. Of course, there are also vocational training offered to young people under the program. Are there any cases where young people actually manage to get out of intergenerational poverty after joining the program? It's because this is the ultimate goal of the program. Now, as the policy address mentions, by the end of this year, the 4th edition of the Strive and Rise program will be launched. And $10 million from the CE dedicated fund will be dedicated to the Strive and Rise Alumni Club. The Youth Link was, for example, very successful. So I want to know if alumni of the Strive and Rise program will be able to join the Youth Link to further strengthen the young people's network. Secretary, I'll ask the Permanent Secretary to address the questions. Permanent Secretary, please. Thank you. I thank Mr. Benson-Look for his support for the Strive and Rise program. Indeed, we are not facing a financial problem under the program. The greatest challenge we face as we continue to implement the program is to identify mentors. Of course, we also have got a lot of support from these mentors. Money is one crucial factor. But the greatest help for young people who join the program is to have mentors that help them broaden their horizons and build up their personal network. So this is what we're going to continue to do under the program. As for the sustainability of the Strive and Rise program, I believe it relies on the continuous participation of all sectors of the community. This is more crucial than our financial viability. Mr. Look was right that we have the Strive and Rise program, and according to this year's policy address, we'll continue to inject funds into the Child Development Fund. We want to ensure that during the formative stage of young people and young children, they'll be able to get support to help them get out of intergenerational poverty. We have come up with KPIs for the program. We've also invited some tertiary institutions to conduct surveys and studies for us to track the results of the Strive and Rise program so that we can have a better idea of the outcome and effectiveness of the program. In case we want to continue to implement the Strive and Rise program, based on the results of the studies, we can make improvements. Now, we welcome any connection between the Strive and Rise Alumni Club as well as the Youth Link or other youth organizations. Perhaps after the meeting, we can have a discussion on how we can integrate the resources in the long run to make both or all of these schemes more effective. Mr. Stanley Lee, I've looked at the policy address, and it is uneasy for the government to roll out all these initiatives. So all these initiatives deserve our recognition. Now, I've been caring about if there is enough support for carers, and I was told by carers that they want to thank the government for earmarking $500 million of recurrent expenditure for supporting carers. A lot of the carer-based and carer-oriented policy initiatives and suggestions have been taken forward. For example, we have the data platform for carers, and I'm happy about that. Ultimately, I hope that there could be a center dedicated to supporting carers. I know that different charity organizations and NGOs are running these centers. However, we have some 300 to 400,000 carers in Hong Kong. And as mentioned, we'll have a greater population aged above 80 a few years later. Well, I have visited different centers for supporting carers. These centers offer respite services for carers and also offer spaces and room for carers to have their self-time. However, the support is not enough. We're facing a low birth rate. In terms of the government's policy, well, will the government make use of existing youth centers and turn them into centers for supporting carers? This is my first point.
Next, $180 million will be channeled into the Child Development Fund. We used to say people start at the starting line, but it is less commonly heard right now, thanks to the greater support provided by the government. For families that are making a meager living, can they be covered under these schemes as well? Turning to my next point, I'd like to talk about carers. I'm glad to see that the LWB is working with other departments, say the housing departments and the hospital authority. But can you work with even more departments, say the immigration department, the police force, and the security bureau? If carers are arrested by law enforcement agencies, is there any mechanism to inform the LWB? Otherwise, those being cared about cannot even get a hold of their carers. Thank you. Secretary, thank you, Mr. Lee, for your questions. We have been working very closely in the past few years. We have done a lot on supporting carers. I understand that Mr. Lee wants to have new standalone support centers for carers. I know different people in society are working on this, but resources are limited at present. If we had additional resources, we should channel such into existing services. The pressure of carers actually stems from those being cared about, say PWDs and elderly people. Carers feel pressure because of the people they are caring about. If there are respite services, I believe the pressure will be eased. We need to make better use of existing resources. We need to focus our resources on those being cared about. Say we have a lot of different youth centers. We need to make better use of them so that they can provide more functions. Thank you, Ms. Lee, for your good suggestion. Next, in relation to data, we work with the PDPC. There is a significant principle which is related to the health of the data subject. For security data and immigration data, they aren't directly linked to health. And we need to base the sharing of data on this important principle. All the sharing of information needs to be in compliance with the PDPO, otherwise we cannot do so. We need to comply with the existing PDPO. There are strict regulations and guidelines, In relation to the sharing of information, we need to make members of the public worry-free. That's why we need to be in strict compliance with the PCPD. Ms. Judy Chan. Thank you, Secretary. I'd like to applaud the policy about school-based after-school care service. I need to commend the relaxation of quota. As carers, as parents, they need to take a rest. Just now, the Secretary said there is no KPI about rejoining the labor force among parents. For the school-based after-school care services, carers can take a break, and to a certain degree, this can also help unleash the potential of working women. Well, of course, we don't make it mandatory for parents joining the scheme to rejoin the labor force. But NGOs can organize more workshops, provide more information, provide job matching in job fairs. This can help parents who want to go to work. Women who have just given birth need some incentive for them to join the labor force again after they have given birth. In paragraph 17 of the paper, the government will provide transitional support to young people leaving residential childcare services without family support. Career planning, vocational training, life skills training are mentioned. But actually, the greatest difficulty lies in paying rents. In this regard, will more assistance be provided? I know a lot of subsidies have been provided to young people. Now we have youth post hostel, but the threshold is actually very high. It is difficult for young people to meet the requirement. However, lowering the threshold seems to be unfair to other people. What about having the threshold? Can we lower the threshold by half? Turning to the next point, which the policy address doesn't touch on, in relation to the adoption of children. There are at present some hiccups in relation to legislation. That's in relation to obtaining consent from their birth parents. It may take a few years. But we should limit the age threshold to a maximum of 3 years old for children to be adopted. We need to relax the existing legislation. Say if the birth parents cannot be located for 12 months, children should be allowed to be adopted and they should be taken care of by a new family. Secretary, thank you. Thank you, Ms. Judy Chen. Regarding the school-based after-school care service scheme, we don't just help mothers. Well, I mean, we don't just help the children, but we are actually helping the mothers as well. NGOs provide a lot of information for these mothers to find a job. They can even go to the Employees Returning Board. Regarding paragraph 17, for those leaving residential childcare services without family support, I believe Ms. Judy Chen is familiar with the situation. So is Chairman. Ms. Judy Chen made a very good point. Accommodation remains a major challenge. The HYAB is doing a good job. We have been liaising with the HYAB. Youth hostels can be mobilized to provide accommodation units for these young people. For young people leaving residential care homes after the age of 18, accommodation units can be provided for those who cannot get a hold of a home. I thank Ms. Chan for mentioning this point. I'd like to take this opportunity to say that the government cannot pour more resources into this area. It is not the case that we don't want, but resources are limited. From the age of 18 to early 20s, we don't want young people to experience this difficulty. We aren't just helping young people, we are actually helping younger generations as well. Turning to the point of adoption, I have related this point to some organizations as well. But we aren't yet in the stage of legislative amendments. The adoption of children requires the consent of birth parents. But sometimes we cannot get a hold of these birth parents. Some birth parents aren't responsible. But we cannot make amendments or make some changes across the board. Sometimes they have difficulties in life, they cannot take care of their children. However, when they are more financially capable, they want to take care of their children in the future. I'm not saying that we're not going to work on it, but we need to tread very cautiously. It is not yet on the agenda of legislative amendments, but we need to strike a balance. We need to hear all voices of the community. We need to have an approach that is in line with the major views in the community. Thank you. Next member, Dr. Tan Yueheng. I have 2 points of concern. Paragraph 3, targeted poverty alleviation. On the point of community living room, it is a great success. It is well received and it solved a lot of different problems of the grassroots. Different social organizations and enterprises are taking part in this scheme. There are a total of 15 community living rooms in Hong Kong. They can help as many as 7,000 subdivided unit households. What about the coverage ratio of basic housing unit households? In the course of planning in the future, how many community living rooms do we need in order to satisfy the needs of basic housing unit households without affecting social welfare resources? How can we do so? In paragraph number 9, about the GBA elderly care services, I'd like to ask a question. I'd like to ask about seeking medical treatment. There are people going to the GBA for consumption and for retirement as well as for medical treatment. This is a trend that we cannot prevent. There are more and more people heading north or going to the GBA for medical treatment. For Shenzhen Hospital, you don't need to line up for a long while before you can see a doctor. But for Hong Kong residents going to Shenzhen, their situation is different. For those in the mainland, they have their own medical insurance. They don't have to pay cash. But for Hong Kong residents going to Shenzhen for medical treatment, they don't have medical insurance and they will have to pay. There is a certain level of inconvenience. As I understand, for the Shenzhen municipal government, there are facilitation policies for Hong Kong people to apply for medical insurance. However, Hong Kong locals don't necessarily have a good understanding of the application for medical insurance in Shenzhen or in the GBA. I'd like to ask about any publicity work. Are there any publicity initiatives do you have any coordination in this regard in order to provide more convenience for Hong Kongers going to the GBA for medical treatment?
Secretary, I thank Dr. Tan Yueheng for the questions. I will provide as much information as possible. Currently, we have 9 community living rooms. It is expected that next year there will be 6 more, so in total there will be 15. Our KPI is to take care of 7,000 SDU households. In reality, perhaps more households will benefit. For example, the first community living room in Sham Shui Po, the KPI we said was to benefit 500 households, but it ended up benefiting 800 households. So at the end, we will benefit more than 7,000 households. According to statistics in Hong Kong, there are over 111,000 SDU households, but not all SDU households require such service. As I understand, there are about 30 to 40,000 SDU households with children. So that's why we came up with the figure of about 7,000. So the coverage rate will be about 20 to 25%. As the SAR government provides more light public housing units, as we speed up the development of housing, including transitional housing, according to our experience, a lot of the previous users of community living rooms will be allocated a public housing unit, and that would release room for other users. We believe that we will be able to benefit 7,000 SDU households in various districts. We will try our best to offer support to them. So yes, we won't just benefit these 7,000 households. We've got very good feedback about the community living rooms, and some community organizations told us that they are willing to offer space for us to set up community living rooms, so we will try our best to offer support to those in need. Now turning to the residential care schemes in Guangdong, there are currently 24 designated RCHEs under the scheme. With our support, participating elderly people can get national basic medical insurance policy from the mainland. Every month, we will offer $10,000 of subsidy. At most, including in-hospital services, we will offer $30,000. As far as I understand, different mainland cities offer different insurance schemes and policies. 8 out of the 9 GBA cities welcome elderly people from Hong Kong to get a residence permit there. So those who get a residence permit, they will be able to apply for the different types of medical insurance. Shenzhen, however, is an exception. You have to pay medical insurance there in order to get the insurance benefit. We have 8 different cities under the scheme, and we respect the practice in Shenzhen. For those who cannot get medical insurance in the mainland, or those who can get medical insurance, they can make use of the 10,000 RMB subsidy. Well, medical insurance usually costs just about a few $100s in the mainland, and under the co-payment approach, participants can get the $10,000 of subsidies from the SAR government. We will step up publicity as much as possible so that elderly people in Hong Kong are aware that our country is offering lots of facilitating measures and incentives for our elderly people. Secretary, I'd like to follow up on the question asked by Mr. Ambrose Lam about the children proceedings, parental responsibility. I understand totally that we have to have a consensus at the community level. However, we have come across those who support the enactment of legislation. Well, the bill has been there for years. I want to know if there are any objective ways for us to gauge whether there is a need to have the legislation enacted. For example, will there be an objective way for us to decide on whether there's a need to enact the legislation? There must be divergent views in the community. I want to know if there are any objective criteria to decide whether there's a need to enact the legislation. For those in the legal sector, they're of the view that it has been some 20 years. We just want some objective ways to decide when it is necessary for us to enact legislation. Secretary, it is true that it's hard for us to use data to decide when it is necessary to enact legislation. Starting from next year, we'll step up education. But even with education, we won't be able to completely change people's mind. However, we should at least offer assurance to people. We have to let people understand that the parental responsibility scheme is not something bad. However, it's hard for us to gauge whether this is necessary. At the end of the day, it will be up to the Secretary to make a decision. There will definitely be opposing views, so the Secretary will have to make a political decision then. If the Secretary is of the view that there is a general consensus, then the Secretary will take up the political responsibility to give a green light to this bill. However, if there are strong opposing views at the community level, then the government will have to explain to the legal sector that we haven't yet reached a point where it is appropriate for us to pass the bill. However, if we do have a consensus, we are willing to work with the legal sector. We may ask for the Law Society for help. It's sometimes hard for us to explain to the grassroots. We have to make sure that they understand. We have to ease their concerns. We think that this is good for them, but they might be of the view that after the passage of the bill, it will worsen their lives. So we have to address the fear at the bottom of their heart. We have to address their worries and concerns. We have to put ourselves into their shoes. So at the end of the day, it will be the Secretary who will have to take up the responsibility. We are actually starting our work in this area. So that's all for this item. The next item is Community Mental Health Support Services. Please refer to LC paper number CB-11422/2025-05. I'll invite the government representatives to join us. Attending this item, we have Mr. Ho Kai-ming, Undersecretary for Labour and Welfare, and his team.
好，我哋請阿副局介紹文件啦。如果想
I'll invite the Undersecretary walk us through the paper. Those who'd like to speak, please press the request to speak button. Undersecretary, please. Members, Chairman, this paper briefs members on the latest development of the community mental health support. For those in need, we offer support to carers, families of those with mental health issues. This is to address carers' stress and concern. The government, through subsidized organizations, offer community mental health support services, including the integrated centers for persons in mental recovery. We also have parent-relative resource centers. We have the scheme of 2 school social workers for each school. We also have cyber youth support teams at schools to offer help to at-risk and hidden youth, including young people with suicidal thoughts and those who are emotionally unstable. Through stepping up family education, we enhance people's awareness of the importance of mental wellness so that they can build a positive attitude towards this. We also want to reach the target of early identification, early intervention. In year 2023 to 24, we took forward a number of initiatives, and these have been implemented in a gradual manner. For example, this June, we set up a center for persons in mental recovery. And this June, we also set up a training program for social workers working for social welfare units. We've also stepped up support for the cyber youth support teams. Moving forward, in the first quarter of 2016, we will regularize the transitional support for persons in mental recovery. We'll also introduce one more integrated center for those with mental health needs. In the latest policy address, there are a number of initiatives to support people's mental health. The Secretary in the previous item have talked about these initiatives. We are happy to listen to members' views, and we are happy to take questions from members. 2 members have asked to speak. They are Ms. Connie Lam and Ms. Lillian Kwok. I'll give each of them 5 minutes. However, I won't be so strict with the time. Ms. Connie Lam, please. Thank you, Chairman. I have always been concerned about community mental health support services. I agree that the government should step up community mental health support services targeting different age groups, including children and young people. Understand that there will be parents, relatives resource centers to support carers as well as people with mental health needs. On different occasions, I have mentioned, for example, in Sai Kung District, there is an organization supporting deaf people that's currently running the parents' relative resource centers there. They aren't so familiar with the needs of those with mental health problems. In recent years, I've been calling for a special screening service at the population census exercise. Through population census, you can learn about the mental health status of people in Hong Kong. With the data, we can perhaps identify certain districts in, for example, Kowloon or the New Territories with a greater number of family with mental health needs. Then we can focus our resources in offering support to people in those districts. That way, we can better cater to the needs of people with mental health needs. Every month, we have tragedies involving people with mental health problems. So I do hope that the services offered by the government can be provided in a more targeted manner. In the past, we often asked service users to go to centers to meet with the social workers or counselors. However, this could be challenging when it comes to outreaching services and support. With available data, we may be able to offer support in a more targeted manner. This is my comment. I'd like a reply from the administration. Thank you. Undersecretary, I thank Ms. Lam for the questions. I'll ask my colleague to supplement later. Ms. Lam mentions about a parent-relative resource centers in Sai Kung. The NGO that's running this center offers more help to deaf people, but they have won the tender, so they must have the relevant experience to provide support services to the targeted group. Maybe because of the name, the local residents thought that it is an organization without the experience in offering support to people with mental health needs. Now, I have been a worker under the census scheme. Each worker spend very little time on interviewing households, so I'm not sure if we can actually get the relevant data during the population census exercise. I will have to talk to the Census and Statistics Department about this.
Mr. Ng, thank you. For the Parent Resource Center in Sai-Kung, we have an understanding that we will provide service for parents of the disabled. There are also other parent resource centers in other areas providing service for persons in mental recovery. In June this year, there is a parent resource center in Kowloon East. In addition, we have added 4 more resource centers for persons in mental recovery, say on Hong Kong Island, Kowloon West, New Territories East, and New Territories West. That's all from me. Thank you. Next member, Ms. Lillian Kwok. Thank you, Chairman. I have had quite a lot of meetings with the administration on mental health. I thank the current term government for providing more policies on mental health. And there is going to be a tiered model of mental health. In the report provided to the panel, I cannot see any mention of student counseling. In the district health center, I do want professionals with a psychology background or counseling background. We need this type of professionals to provide professional training in district health center. At schools, sometimes there isn't anyone with counselors or with counseling background. We do need counseling, and when the government provides social welfare workers, they said, well, these are counselors, but they are not the same. You said you would start with primary schools before extending the scheme to secondary school, but then there isn't any work done on primary schools. In relation to the Integrated Community Center for Mental Wellness, ICCMW, there is a top-down approach that is from the hospital and then referred to the ICCMW. We do need to work on prevention at the center. We need to provide services so that members of the public don't have to go to different districts to enjoy services. We want to incorporate the step care model for mental health into the ICCMW to provide district-based services. At present, we have the 3-tier mechanism, and I do want to see it being implemented. These are my comments, and I'd like to see if the administration can improve your mechanism and adopt my suggestion. Undersecretary. Thank you, Ms. Kwok. Indeed, we have the 3-tier emergency mechanism. We are working with the Education Bureau and the Health Bureau. As Ms. Kwok said just now, some counselors will work in the district health center to provide assistance. We have to liaise with the the Health Bureau to confirm this. Mainly, we work on cases to provide counseling and mental health. Social welfare workers work in the community to provide services, and we will liaise with the Education Bureau and the Health Bureau to confirm the details to see if they can pull more resources into this regard. Thank you. Chairman, I have some follow-up. Well, let me cut to the chase. The government touched upon counseling. In overseas jurisdictions, there are quite comprehensive step care models. There is also division of labor between social welfare workers and counselors. I'd like to ask about the future plan of the Social Welfare Department. For those with a background of counseling, how can they join the Social Welfare Department? How will the department use the services to support people with counseling need? Well, we have a one-off grant. Organizations can use their resources to engage professionals with a counseling background. We talked to Ms. Kwok about this previously. They want to provide for professional registration of counselors, but this is not within our purview. Well, I understand when it comes to registration, we need mature conditions. That's exactly why I didn't ask for registration at this stage. Mr. Ng, regarding social welfare workers, at school, the training covers counseling as well. So we cannot separate social welfare workers and counseling. Basically, social welfare workers are responsible for providing counseling services as well. Now, we are implementing 2 school social workers for each school. There are a total of 900 social workers at schools. They provide counseling, group activities, and so on. That's all from me. Thank you. Ms. Kwok? Well, I have a little bit of follow-up. Thank you for referring to the training of social welfare workers. It covers counseling. That is what the administration said. Well, basically, the training hours spent on counseling for social welfare workers is exactly the same as that for teachers. Does it mean that they can provide psychology services as well? 320 hours out of 2 years. And I believe that is a little bit different. That's exactly why a social welfare worker is different from a counselor. The administration should study more carefully different professional positions. Turning to my next point, you often talk about providing support in the community. Just now you talked about some referral cases, say providing support at the second tier. So how can we leverage the support of the counseling profession? And I want you to study the complementarity and the coordination between counselors and social welfare workers. I hope the administration will look into it in a detailed manner. If you think there is insufficient research, there aren't enough papers, just tell me. I can definitely provide more reference materials for the administration. All right, Undersecretary, anything to add? Well, we will go back to study this. Thank you. Any members would like to speak? Any other business? There being no other business, that is the end of this meeting. Meeting adjourned.